Yes, Dr. PJ Muriuki is here with us. He is a dentist and we talk about dental health. I mean, you have your dental formula intact, as say. There's always that fear that comes along with, what do I eat? How do I brush? How do I make sure that, you know what, in future I do not have problems with my dental health and so much more. So there's always these questions that will arise as to how well we can take care of ourselves. You know, you look at your little boy and you think, well, you probably need to be careful, extra careful as a mother in terms of how they handle their teeth. Long gone, I mean, you would be told that perhaps we never used to brush our teeth when we were young. Those days, I don't know whether you were lucky enough to be born in this family where this was a must. But today, I have to look at, my little boy and say, brush before you sleep, brush the moment you wake up. And as late as, I don't know, the day before yesterday, someone was telling me, it's not even right for kids to brush their teeth. Sijui mzuri, there's somebody else who told me, you know what, don't go into this, toothpaste and all that. Brush your teeth with salt. And to be honest, you are close to them. They have a nice breath. They seem to have a very good, dental formula, and you ask yourself, just who is not telling us the truth? So Daktari is here for us to look at, general dental health, and therefore that means it's open for you to ask any question that, would appear as though it's a myth or you could be causing you worry as to how you make sure that you have a proper dental health. So the hashtag is MorningCafe at Linda_Alela TV47KE, and it starts off with that very point that, kids really should not brush their teeth. I mean, we never used to. And look at my teeth. They're not badly off, Daktari.
Yeah.
They are not.
Yes, thank you very much for having me. And I think that's why we are here, to demystify dentistry, because like you rightly put, there are so many things that are being peddled around, and unfortunately most of them are not true. Just by a way of answering that viewer, you should brush your teeth, and for us dentists, we recommend that you brush with a fluoridated toothpaste.
Okay.
And especially for kids, it is important because what brushing does, it actually disintegrates what we call the plaque. Plaque is an amalgamation of bacteria and food debris that are left on your teeth after eating.
From what age? Because then you see them with these two bellies, and the parents are busy trying to brush that.
Yeah.
From what age should you say now start having your kids brush their teeth?
Actually, we say even before the teeth grow.
Oh.
You should actually be brushing, not really brushing, but wiping the gum pads.
Okay.
What that does is it makes the kid, when they are very young, to get used to their teeth being, brushed and touched. So the moment that the small two teeth come into the mouth, then you are not supposed to really use a brush because that's a young kid. What you're supposed to do is you're supposed to wipe the teeth with a cloth that is wet. The reason why we say this is because there's something you call early childhood caries. Yeah. Early childhood caries is basically, decay of those milk teeth. And most of the time it is caused by breastfeeding. Okay. Because as we know, breast milk has a lot of sugars, and those babies, immediately they are breastfeeding, sometimes they even sleep. And when they sleep with this milk still in contact with the teeth. Okay. So it is important that you wipe that layer off, because that is a substrate for making those teeth to decay. Yes.
So when you speak about decay, hugely is it about what we eat, or are there other factors that could contribute to the same?
Mostly it's what we eat and also the oral hygiene practices. Like I've said, for example, for young babies, once you wipe off that layer, because bacteria need that layer of food debris for it to be able to, for the bacteria to be able to cause any damage to the teeth. And that's why we brush, to make sure that the bacteria, because the mouth has a lot of bacteria, but in the right environment, we have a symbiotic relationship with this bacteria. But now the moment you don't brush your teeth, the environment in the mouth changes, and these good bacteria turn out now to be harmful, and they now cause havoc on the teeth. And that is why especially we say that the most important time to brush is at night. Because you see, during the day you are talking, your tongue is brushing along your teeth, you are drinking water and other things, but at night your mouth is free. So the bacteria are having a party in your mouth, because especially if you didn't brush, because now they have all this food that was stuck in between the teeth, and that is when most of the damage happens. So the reason for brushing is really to disintegrate what we call the biofilm. Biofilm is a combination of the food debris, the bacteria, because this is now what forms the plaque, which can cause you decay or even gum disease. Yes.
I have this colleague of mine who will always walk with their mouthwash. They love sweets, they love chocolates. And they say, well, for safety purposes, once they savour on their chocolate, then they get to the mouthwash, they, you know, gargle a bit and they throw it away. Is that really helpful in any way?
It's better than doing nothing.
Oh, it's better than, okay, well, all right, fair enough.
But what really we recommend is the physical disintegration of the biofilm. You see, by using just a toothbrush, and even if you can't get a toothpaste, even if you use salt or whatever, it is good enough. Because like I said, what we want is to, you know, remove that layer, that coating that is on top of the tooth, which is the one that causes damage. Mouthwashes are good, but you know, for us that is secondary. And there are those people that, for example, that have gum disease, that we would prescribe the use of mouthwash. But you know, the most important thing for us is actually brushing, which is inexpensive, because even using a twig, you know, those twigs that we used to use when we are young, they are good enough. They are good enough. But if you can be able to afford a fluoridated toothpaste, that goes a long way, because fluoride, and I know we'll talk about fluoride more, but fluoride in toothpaste, what it does, it actually helps to remineralize the teeth. Topical fluoride. We call it topical because it's being applied on top of the teeth. It's not being ingested. When it's applied on top of the teeth, it actually helps with remineralization of the teeth. Yes.
And it can be sweet, sometimes tempting, so it is a danger for especially the kids. If left unattended to, they will tend to swallow some of these toothpaste that they use.
Actually, we say that fluoride is an angel and a devil at the same time. It's an angel when used on the teeth, like topically. We call it topical fluoride, meaning that it is being just applied on the teeth. That way it helps to remineralize the teeth and protect the teeth from getting decay. However, if fluoride is swallowed, you know, and it gets inside the body, then now it becomes a devil, because that is what now can cause what we call dental fluorosis, and especially this we see more when you take water that has high fluoride, right? So that's why you're seeing, for example, and I'm sure that's part of what probably viewers would ask.
And I mean, I was a little bit confused that you are encouraged to use toothpaste that is rich in fluoride, but at the same time then you're told do not get to consume water that is rich in fluoride. So it gets you confused somewhere in there.
And that's why I said it's an angel and a devil. And the distinction is how, whether it is just being on the teeth, it is good, right? And especially it's important to mention, that's why for kids we usually say that you just give them a pea size of toothpaste, not a lot, just a very small quantity, so that, you know, they don't swallow it. And when you use it on teeth, it is good. But now when fluoride is ingested or swallowed, either through toothpaste or continuous swallowing of toothpaste or ingestion mostly through water, then now you get what we call dental fluorosis. Dental fluorosis basically is an irreversible condition that affects the outer layer of the teeth, and these teeth are characterized by discoloration. Most of it's you find most patients have discoloration ranging from yellow to brown. And for most of the people, you find that in severe cases, the outer surface starts even to shell off. Yeah, and those people will tell you that they have very much, I mean, they have a lot of sensitivity, and also in terms of esteem, especially young people. They have a lot of esteem issues because, of course, their teeth don't look nice. They are discolored, and in severe cases, you find they've even broken down. So even function sometimes is affected. So now that is what is called dental fluorosis. And mostly, like I mentioned before, it's caused by consumption of water with high fluoride content. Now, consumption meaning that you are taking in either by drinking or by cooking.
Is it?
Yes. Either
I
by
thought
drinking.
when it goes through the fire, then, and I mean, most of the people will tell you it's fine. It is salty. It is high in fluoride. But if you boil it, and that's why they always encourage boil it and then let it settle down. It gets cold, and then you can drink. That one is now safe for drinking.
Unfortunately not. What boiling does, it only kills what we call organic matter, and this we mean bacteria and some viruses, pores, and all those things. But fluoride is like a salt. So I'll give you an example. You have water that is salty, then you boil that water. What happens? It actually becomes more concentrated. Because some of the water evaporates.
That's true. So,
but the minerals are still left inside the water. So boiling water does not alter the fluoride content. So I mean, those people who say that they'll boil water, let it cool, what it does is it makes it safe for drinking in terms of the water does not have, it may kill some bacteria and all those things, but the inorganic content means the mineral position of that water is not affected.
But just what are you telling these people who stay in areas where, well, it's all known that the water there is salty and there's really nothing more they can do? I mean, you understand the troubles that we have in the country in terms of, getting fresh water. That might be as well as, a pipe dream, something that will never get to happen. So what do you tell such people? That all hope is lost for them, that they should brave themselves for years, having teeth that is discolored already, and perhaps having these difficulties. And I'd want to assume that this goes even to the bones, because the formation of the teeth, more or less the same thing with the bones.
Actually, that's very correct, and it's actually an emerging dental public health concern in the country. And it's a condition that we are seeing in our clinics and in our hospitals. Just as a way of just clarifying, I mean, when you ingest high fluoride content in water, it can do two things. It can cause you dental fluorosis, which is basically the discoloration of teeth, but also it can cause you what we call skeletal fluorosis, because, like you said, the bones and the teeth are more or less composed of the same thing. And for dental fluorosis, it normally affects you from 0, that is meaning when you are in your mother's womb.
Is it?
To around 12 to 14 years.
What do you mean? So it starts from there. So any teeth that comes out or any tooth that comes out will be discolored?
It will be discolored.
At such a tender age?
Yes. It can actually even affect the milk teeth, because you see, teeth start forming when you're still in your mother's womb. Actually,
and I think we're going to come to pregnancy and
so within when the baby is forming in the mother's womb, teeth start developing as early as the first trimester.
Look here, Dr. Are you telling us this, that perhaps I give birth to a child, and they've been consuming so much of water that has a lot of fluoride, and then their teeth get to develop, and perhaps we even have removed the milk teeth, and we're good. So if we move to a place where now the water is salty, high in fluoride, we should not be worried that perhaps this would discolor our teeth?
All right. So like I was saying, it starts affecting you from when a pregnant woman takes water with high fluoride content. That fluoride is able to go through the umbilical cord and get to the baby. All right? So when it gets there and the teeth are forming and the other bones are forming and everything, so that fluoride will actually affect those teeth. And teeth usually form, both milk teeth and permanent teeth, they form inside the bone and then they erupt into the mouth. So depending on the time of exposure, you might find that someone had milk teeth affected, then probably the exposure to fluoride stopped. So you'll find that you can it's not a must that you have all the teeth affected at the time. It depends with the timing of the exposure, the duration of the exposure, and the amount. Because again, depending on the dosage of fluoride that you are exposed to, it will vary from mild, and sometimes in mild you don't even know that you have the condition because the teeth are still white. It's only that they have some speckles of discoloration and hypomineralization. But now, depending on the dosage of exposure to fluoride, then it will affect the severity. And that's why we're saying between 0 to around 12 years, because after 12 years, there is no other tooth that really is forming. Because remember, it affects the teeth during formation. So it is, it comes and becomes incorporated within the tooth structure as the tooth is forming. So once the teeth have formed, actually teeth are the only part of the body that does not regenerate. For example, if you cut yourself, you'll heal. But when a tooth gets a cavity, it does not heal itself. So therefore, if you are exposed when all the teeth are formed, like you and me now, even if we went to a place with high fluoride water, our teeth will not get affected. But for a kid who's below 12 years, because some of the teeth are still forming, depending on the age that they are at, their teeth will get affected. But for us, what will get affected? Our bones. Yes, because bones actually remodel. They undergo remodeling. So, and as they are remodeling, if the fluoride content in the bloodstream is very high, that is how the bones will also be. The same thing that we see happening on the teeth is what is happening on the bone. It's only that now bones are not visible. So the same way we see brown teeth, that's the same thing that is happening on the bone. And the bones really become weak. And there are also other systemic effects of fluoride. For example, even still on a pregnant woman, when you're exposed to high fluoride content, you can even have a premature labor. You can also have low birth weight for the children. There is research. There is a lot of research that has shown that. There is also research to show that kids who are in areas that have high fluoride content have low IQ. It even affects
this automatically goes to even a child who was otherwise born to have perhaps they are bright kids.
Yes.
That this would deter or maybe
Yes. High fluoride
derail
content.
there.
Yes, actually it affects some of those developments, and there's a colleague of ours who did a research, a very good research, and it actually shows it affects the IQ of
So how can we help these ones? I would want to assume that then the research should have been backed up by calls to action or calls to action or solutions, if any. Fine, this is Naivasha. Naivasha is maji ya chumvi all through. So what do we do? Do we just let them languish? Do we just let them, do we tell them to shift and move to other places? That is impossible. Are there options of reversing this components of fluorides in such waters so that at least we can even reduce the levels?
Good. That's a very good question, and as you know, nowadays we are moving more into prevention rather than just waiting for problems to happen for us to look for a solution. Because like I said, dental fluorosis is an irreversible condition. So the only thing that we normally do as dentists is basically to try and restore the teeth, either using doing masking or doing crowns and veneers. But the condition, I mean, we are just masking for people not to see. The problem, like I said, is becoming too much, and we are hypothesizing that the reason why the problem is becoming too much is because of also the way we've started settling in the outskirts of Nairobi. And what is happening then is the more people are settling and finding and building their own houses, in some of those areas, we don't have the amenities in terms of regular supply of water. So what happens then is that people start digging boreholes to supplement the water that they are having. And we've seen this even in apartments. Most of the apartments in Nairobi nowadays have supplemental supply of water from boreholes. But now the unfortunate thing is this water, most of it has very high fluoride content and people are not aware. So number one action is what we are doing right now, letting people know that there is indeed a problem. Then the second thing is really imploring on the government to ensure that people have safe water for drinking.
Yeah.
Because some people are drinking poison. The WHO recommendation of fluoride in water is 0.5 milligrams per liter. Some of my colleagues have done research and have shown areas that have 2,700 milligrams per liter.
Okay.
That's poison. We are basically poisoning our people. And remember, if fluoride is high, you might even find other heavy metals there, lead, mercury, and all those things. And those are poisonous. And that's why probably you are seeing even the rise in the number of cases of cancer. So really, the government has to step in. But most importantly is also personal responsibility.
Yeah.
And I'm glad to say, because as you may know, I'm also a council member in the Kenya Dental Association.
Yeah.
And in our scientific conference, we had one of our colleagues presenting about a solution after many years of research with some German partners.
Yeah.
And there's a machine, it's called a defluoridation machine, that basically what it does is you install it in your house. Once you install it in the house, then it defluoridates the water. It purifies and defluoridates the water.
Okay.
Why I'm more particular in this is because I'm a scientist myself, and really we work with facts. And it was presented in our annual scientific conference, and it is something that we've seen that it works. Because there are many other filters, and I think it's something that people also need to know. There's difference between filters or purifiers and a machine that can do what we call defluoridation of the water. So filtration basically means, for example, I have dirty water here. So you have dirty water here, you use a purifier, here you'll have clean water, all right? But if this dirty water had high fluoride content and other mineral impurities, so here we'll have dirty water with high fluoride and mercury and all those things. Here we'll have clean water, but it still has those high fluoride and all those other things. So that is what a purifier does. It just makes dirty water clean by removing the physical impurities.
Yeah.
But now, that machine, what it does, it's called a platinum vaser. What it does is, it does the purification, and most importantly for us, removes all the heavy metals, of which fluoride is one of them. And it's strategically installed in your kitchen. What that does is it makes sure that the water that you're using also for cooking, because that's a gap.
That's a gap. Yes. Most of the time people will focus on buying bottles of water and
Yes, but they cook with the water with the high fluoride. So it is strategically installed in the kitchen, because then it will make sure that the water you are using for cooking and also the water that you'll be using for drinking is safe.
Okay.
And most importantly, it doesn't matter where the water source is, it will take care of it, whether it is contaminated with sewage and all those things, because on top of removing those, it still removes the other organic impurities. And of course, when you do that, you are sure that the water that you are using in your house is safe. Number two, it will also save you on your budget, because then you don't need to buy water. And the sad thing is, some of these water vendors are unregulated. You actually don't know what they are doing. So even the water that you're buying, you could actually be buying a disease.
That's true.
By buying that water. So yes, there is a solution, and it's something that people should actually invest in, and especially the guys who are building around Nairobi and places where they're using borehole water. Because it's cheaper to prevent than to cure.
Right, that's
because I can tell you, doing a veneer or a crown for those teeth is very expensive, because we are looking at probably one tooth being around 40,000, and you can imagine now you have to do around 12 teeth that are for smiling. So if you can be able to prevent your children getting that, it will. I mean, it's always the best.
Okay,
yes.
Amazing. And people ask, what type of toothbrush and toothpaste should we use, and do we really need to floss? And so this appears like it's an outright thing, but you realize that even with the toothbrushes that we use, so often you realize there's a difference. Yes. There are instances where you say, napenda hii brush kushinda ile. This one feels like, once you're done with it, you are feeling clean. And yes, it's gotten to the levels that you want. Yeah. And sometimes people don't even know how to do it.
Yes.
Yeah.
So for a toothbrush, really, what we recommend is either a soft or a medium toothbrush.
Soft.
I get that all the time. Like, you use a soft one and you feel like you're not getting clean. Yeah, you want to use the hard one.
Yes.
But as much as the hard one may make you feel like you've really cleaned your teeth. Yeah. Remember, teeth don't exist in isolation. Okay. They are surrounded by soft tissue. And that is the gum. So sometimes when you use a hard toothbrush, what it does, using the hard toothbrush and also using the wrong technique, I'm sure you've ever probably encountered people when they're brushing, you feel like there's a sawmill somewhere.
So radical.
Just very radical. So as much as the teeth will be clean, now you'll be causing, yourself another problem. Okay. Which is gum recession. So the gum will start running away from the teeth and exposing the root. And that can cause you a lot of sensitivity. Okay. It's because of using that hard brush. So the compromise is usually a medium toothbrush. And also get from a reputable company, because there are others who say it's medium, but it is actually very hard. So once you get that, and then use some circular motions. Don't use a lot of force. It's about the time that you're going to spend and how effective you're going to do it. It's not the force, because really this is food that you've just eaten, so it's not stuck anywhere. So you really don't need to use a lot of force. And like I said, most importantly is make sure you brush at least twice a day. Yeah. And never go to sleep without brushing, because then that allows for the debris to accumulate over 12 hours that you'll be asleep or so. Okay. So toothpaste, you can use any. It's just a matter of preference. There are others who like this brand and that brand, but really, so long as it's a fluoridated toothpaste, it should work. There isn't any that we usually say that this is the best, or I know there are many adverts recommended by 9 out of 10 dentists. Yes. Yeah, but that's just marketing, really. You can use any. It's about how you do it. And if you visit your dentist, they should be able to demonstrate to you how you should be able to brush. Okay. Yes.
And so we always are not so sure when to realize that these are troubles or are signals of dental trouble. Yes. And sometimes you just sit it there. Na kumbe mambo inaendelea vibaya. You can literally see that there's a chip, you see some funny lines on your teeth. Yeah. It's not painful, and therefore you just overlook. Yeah. At what point do you realize that now this is cause for alarm? And perhaps we should have started by asking, how important is it to have often visits to the dentist? Yeah.
That's a good question, and I'm glad you asked it, because as Kenyans, we have very poor oral seeking behavior. Yeah. Meaning that people don't go to the dentist unless they're in pain. And it is worse for men. Yeah. By the time you're seeing a man in your waiting room, you already know what you need to do, because they must be in pain, which is really unfortunate. Because when you go to have checkups and you have them done early, when you don't have a problem, number one, it's inexpensive, because you are going when the problem is not established. Okay. And therefore, sometimes you might even need just to do some, not a lot of things need to be done. Number two, when you go to the dentist early, it helps you to actually know what problems you have, and you are able to schedule then how you are going to sort them out. Yeah. Because for us, and that's why you find most of the Kenyans just have to, go to have their teeth extracted. Why? Because by the time that tooth is paining, it didn't just start yesterday. It started with that small chip. It started with you feeling sensitivity on taking hot or cold things. It just means that that problem is there, but not at an advanced stage.
Okay.
And if you visited a dentist, for example, when you are having sensitivity on a tooth, on probably cold or hot things, most likely they'll just do a filling and it will be sorted. But now, when you wait until you are having pain, there are only two options. Either you're going to lose that tooth if the cavity is very extensive, or you are going to have a root canal done, which is also an expensive affair.
Right.
So the reason why most people say that dental care is expensive is because they go when it is too late. And I always like saying that dental treatment is not expensive, neglect is. When you neglect your teeth and you go when it is too late, there's no magic to it. I mean, you'll have to pay through the nose to have your problem sorted.
So how often, like say in a year?
Yeah, in a year we say, depending, there are people that would tell you do your checkups once a year. When we find that they have good oral hygiene, they don't have any issues with their teeth, or the issues with their teeth have already been sorted. But for most people, we tell them twice a year, every 6 months. That is also the time that you should have your routine cleaning, because there are areas of your teeth that you're not able to access with a brush. So therefore, professional cleaning is important. Yes.
But are there problems or teeth problems that one would say are hereditary? Say wanasema meno za grandfather yangu zilikuwa zinang'oka at this age, and therefore chances are very high that mine as well will have such, problems.
Yes and no, because not all of them. There are some patterns that we usually see, for example, in alignment of teeth. So you find that there are families where you find their teeth are crooked.
Okay.
And which is usually mostly because of the size of the tooth versus the size of the jaw. There's a discrepancy, and you find therefore they are prone to having their teeth crowded, or even difference in size between the upper and the lower jaw. So those ones mostly you see they run in families. The other things, and the reason why most people say that it's hereditary is because, like we've seen, if people live in the same family, they are mostly exposed to the same conditions.
Okay, foods
and all those things. If it's water with high fluoride and all those things. So you find that, in your family that there's people have this kind of problem. And part of the reason is you are exposed to the same local factors. And therefore you see that, they have the same, predisposition to having these conditions. Then you have other things like gum disease and also decay. You find that there are people who are more susceptible to decay. If it's gum disease, there is a certain kind of bacteria that makes you more predisposed to, because gum disease is very wide. So there's a particular type of gum disease that has you find it more in people with a certain kind of bacteria in their mouth, and therefore if it is in the family, you might find they are more predisposed to that. So, but it's not something that cannot be sorted. It is a matter of personal responsibility. When you have a personal responsibility, then you are able to sort those issues, whether or not your family has history of the same. Yes.
And so when you get to the dentist, so for regular checkups, at this point it's allowed or it's wise to have exams conducted, like those ones that are a little bit intense, and perhaps even x-rays?
Yes, when you get there, first of all, of course, it's taking the history. Taking the history means just having a conversation with the dentist. Why you are there, if it's just a checkup, any concerns that you're having, you should be able to discuss with your dentist. Then we even take familial history, by the way, so that you're able to tell whether there is some predisposition to some of those things. Then from there, they'll do oral examination, just checking your teeth and chatting them up. Sometimes you even have very small cavities that are starting that you are not aware of, right? So they should be able to pick them out. And if need be, they'll take some x-rays, especially in those cavities that are borderline.
Okay.
You don't know whether they are too deep or it's a filling or a root canal. And then from there, they are supposed to give you a treatment plan. A treatment plan means how you are going to sort out those issues in order of priority, you know, because there are those issues that can wait and those issues that need to be managed immediately. So that is basically how it's supposed to be. And I always say, like, for example, whenever I see my patients, I don't like putting pressure of, for example, having to have the treatment done at that particular time, unless it's an emergency. The most important thing for me is to make sure that the patient is aware of the issues that they have in their mouth and how they should be sorted and in what order. Then when they go home, they're able to plan themselves and they have the information. So what I'd encourage people is you don't have to have money to have the problem sorted. What you need is, for example, if you can just afford consultation, you just go for a consultation appointment, then you'll be given a treatment plan of what exactly needs to be done.
Okay.
So when you are at home and planning your finances, you know that this is what needs to be done and at what cost.
Okay.
Rather than just staying at home, you don't know whether you have a problem or not. Then you only run when it is too late. Yes.
Those ones that have feelings, and I'm glad that you mentioned it, very important for them to know how they just work it out. And even those ones that have, you know, do we call them plastic teeth or what? Forget about those ones for kids.
Yes.
The one that you're given, that you have to remove and clean the dentures. Yes. And most of the people will tell you they have difficulties on handling this. In as much as you go to the dentist and you're given instructions that after this is how you clean it and all that. And sometimes they also get into the spree of now enjoying foods and all that without thinking of the damage that cost them to have these dentures in the first place. I mean, how do they just handle them? How do they make sure that, you know, how do they work, to ask the question?
Yeah, so I always say in everything that they are, it's about partnership, really, where the clinician or the dentist has their responsibility and also the patient has their responsibility. And if one does not do what they are supposed to do, then the outcome definitely will not be desirable. So sometimes you may find the dentist has given you a very good prosthesis, but then you've been given instructions and you're not following those instructions at home. So therefore, I think it is just a matter of knowing that this is teamwork and following the instructions to the letter, and knowing that if you don't follow those instructions, for example, if you're given an implant and you're told that you're supposed to be flossing and cleaning well in between the implant. So if the implant fails, sometimes you know, people don't take responsibility and they go saying they were not given a good thing, whereas it is actually them who never took responsibility. So it's about teamwork. Both the dentist and the patient has their own responsibilities. And if everyone does their work, then the outcome definitely will be desirable. Yes. Some
of us are notorious that you probably have not had difficulties with your teeth, but there's always that desire to whiten them, you know, especially with my kind of profession. So there's always that need. And sometimes you're told this is toothpaste that will help you whiten it better. This is something that you need to do. You have to go and visit the dentist and get to know how you can, you know, best whiten your teeth. So what goes into this process is that, I mean, we have seen this work for some people, but just how sustainable and how healthy is it again?
Good. That's a good question, because especially in this era of social media and all those. Oh,
you want to smile, smile profile,
Yes. So whitening is a really broad topic, and just as a way of summarizing, it's not a one-fit-all kind of thing. So it is about case selection. What will work for you might not work for me, and therefore the most important thing is for you to visit someone who's qualified, because another problem that we are having is having a lot of quacks on the loose, and people who are advertising themselves all over, we whiten teeth and all those, because some of those things, if done on the wrong patient, have very detrimental effects. There are people that, for example, if you don't do good case selection and you do whitening, let's say like bleaching, those people will have lifelong sensitivity. They'll not even be able to function, yeah, if it's not done safely. There are some of those cases where if you do whitening, for example, and someone has, because some of them use some chemicals, some people react to it. I've seen cases where gums are burnt yeah, out of someone going to have whitening done, because whitening can either be it can be bleaching, and in bleaching we have take home. Sometimes again, depending on the case selection, yeah, some people we might give them something to take home with, and they wear well at home. Others we see them in the office and do a one or two kind of whitening inside the office. Others we use laser, others we do veneers, because for example, if someone has wants whitening and they have teeth that are crooked, whitening them will basically just make them more visible that they are crooked. So that's why I said, for example, for such a person, you might recommend veneers, because veneers will be killing two birds with one stone. We'll be whitening the teeth, we'll select the shade that we want, and at the same time we'll be straightening them. So it's a complex cosmetic issue, and what I'd say is people should do a lot of research in terms of the clinician that is attending to them, because then some of the effects are irreversible, and therefore you need to make sure that the profession who's seeing you is duly qualified to do that. And at the same time, you need to have a candid discussion of the options that are available. Don't just follow influencers and
get excited about
other people and just follow whatever they are doing or wherever they are going. Some of it is just business, and really you need to do a lot of research, because it's also not cheap. It's expensive. So you need to be really sure of what you're doing.
Dr. I'm really being told to come out of this place, but not before we answer these two questions. Sensitive teeth, because you see sometimes the things you say and I can almost, I'm cringing, because it feels like, I don't know whether that is a sign that I have sensitive teeth or that's just normal. And for those ones that truly have sensitive teeth, how do they manage this, as well as the mothers will hit me so hard if I do not speak about the plastic teeth?
I think we first start with the plastic teeth.
It has to be very brief.
So plastic teeth, as we call them, are basically teeth that are found on newborns, and generally we classify them as neonatal teeth or natal teeth. So teeth have a schedule of when they should be able to erupt, even on a young kid. So basically what happens is when a child is born and immediately they are born, you see there is a tooth. That is a natal tooth or a plastic tooth. So the causes of this is sometimes it could be the kid's natural tooth. It's only that the tooth jam, because teeth actually erupt from a tooth jam, was positioned too low. So that now it just took a very small distance for it to come down. Remember what I said, teeth start forming even in the first trimester. So now, so for those teeth, we usually they have to be assessed. The moment you see them, you're supposed to, go to a qualified dentist, even within the hospital where you delivered. So they'll be able to assess. And how we assess is, for example, most mothers come and say they are having problems suckling the kids, because they keep biting on the nipple. And in such cases where the tooth is mobile, it is actually a danger to the kid, because they can easily aspirate that tooth, because it's loose. Can easily aspirate and it blocks the airway, and it can even be fatal. So in such cases, we actually remove. But like I said, it has to be done by a professional, because you can also predispose that kid to a lot of bleeding. Because, for example, if they have not been given the vitamin K shots, because they are just newly born and all those things, there are some things you have to check before you go in and remove that tooth, because they are usually very loose. If it is firm, then you leave it. right? Then there are others called now neonatal teeth. These are teeth that grow. The baby was not born without he was born without that tooth. But after 1 week, 2 weeks, you are seeing there is a tooth there. So again, the fate is the same. Those are called neonatal teeth. You are going to basically have a qualified professional to assess and decide whether they need to be removed or not. But if they are firm, you don't.
You let them be.
Yeah. You
don't and they will grow to be okay.
Yeah.
The others will come out and they'll get these ones and they'll be fine.
Yes.
Okay, we have to close. I mean, Dr. Sensitive teeth. 1 minute.
1 minute. Wow, that's a very huge.
Should we say then you come again, and then we focus on the sensitivity of teeth and what could be the causes and Yeah,
but just as a way of summary again. Don't diagnose yourself as to why your teeth are sensitive, because I'll give you 3 reasons why your teeth could be sensitive. Number 1, it could be that you have a cavity. All right. So a cavity, when the cavity has not yet reached the nerve, it starts by being sensitive to cold and hot things, only on provocation. Number 2, you could also have sensitivity because of gum recession. So gum recession, when the gum recedes away from the tooth, it exposes the root of the tooth, and you get sensitivity. Number 3, you can have wearing off of the surfaces of the teeth, especially for people who grind their teeth and you find that the teeth are short. That can also give you sensitivity. And the management is different depending on what is the cause.
I hope that someday we can spare about 30 minutes or so to speak about that, because it's pretty much a common problem to many people, perhaps the most common that we might be having around, and therefore it's important that we address this. Otherwise, Dr. PJ Muriuki, lots of issues that we have touched on, and I must say, asante sana. I'm sure that anybody who's been watching this broadcast by default has found some remedy to the troubles. But as Daktari would say, please do not self-diagnose. Get to a chance to see the dentist, and that way then it becomes easier for you to manage your condition. Once again, Dr. PJ Muriuki, who's a dentist, and it was